Hi, my name is Dr. Alpesh Desai, and I'm a board-certified dermatologist and the owner of Heights Dermatology in Houston, Texas. I have 20 years of clinical experience and over 25 years of dermatologic research experience. What I'm particularly passionate about are chronic inflammatory disease states. So I'm very happy to be here today. We'll be discussing a topic that's near and dear to me, which is Prurigo Nodularis. These patients are often dismissed, misdiagnosed, and frankly, mistreated. We will explore Daricha's journey with Prurigo Nodularis today. Prurigo nodularis is a chronic inflammatory skin disorder that's characterized by firm nodules or bumps that are intensely itchy and sometimes very painful for a patient. These bumps usually occur on the arms and legs, upper back, and even the abdomen. Although this condition can affect any age range, I see this usually in older adults. And although the cause or etiology of this condition is unknown, it is thought to be an altered function of the nervous system and the immune system in the skin.
2016 is when Prurigo nodularis first appeared on my body. I was diagnosed with it, however, in 2018. There's a gap there because when I got it in 2016, no one knew what it was. I thought I was dying. I went to dermatologists from Miami to West Palm Beach to Tampa. I've heard bed bugs, I've heard eczema, I've heard everything you can think of, but except peeing. Raising awareness about Prurigo nodularis, I just want to let you guys know you're not alone. This disease does not define you. It makes me me. It makes me unique.
I loved how she said in her video that Prurigo nodularis makes her unique. I think that's very empowering for her. Several things made a big impact on me. Number one was a lack of information, knowledge, and awareness that the medical community and the dermatologic community had in regards to Prurigo nodularis. Secondly, the amount of time it took for a formal diagnosis for Daricha was, I think in the video she said 2 years, and that's a common story that I hear in the clinic daily. As clinicians, we need to be aware of Prurigo nodularis. We need to know what it is and how it presents. And if we suspect Prurigo nodularis, we can do some additional testing such as biopsies that can confirm the diagnosis. We have to be our biggest advocate for our patients. And if that means referring the patient out to someone that has more experience, then that's okay because it's a win-win situation for everyone.
Peeing had a horrible effect on my mental state. I was depressed. I started eating. I got overweight. My self-esteem was out the door. I kept telling my mom I'm ugly. I don't want to go anywhere. I look like a monster. I spent those 2 years inside my room.
Prurigo nodularis patients often experience anxiety, depression. They have a hard time forming or maintaining intimate relationships. Something as simple as going to the grocery store can be really traumatic. The other thing that we often don't talk about with Prurigo nodularis patients is a lack of sleep that these patients encounter or experience. These patients are tired, they're fatigued, their mood is all over the place. This affects their personality, affects their work, affects their relationships, perhaps with their parents, their kids, their loved ones. As we learn more about Prurigo nodularis, I think we have to be sensitive to these things. What I do in my practice is that I always have a depression questionnaire for all my Prurigo nodularis patients because I want to see where they are from a mental health status. I think the mental health of these patients is just as important as their skin.
My mom had glaucoma in one eye. So we end up going to this eye institution, and I just feel like everything happened for a reason because I needed to be there for me to see a poster about Prurigo nodularis research. Mind you, I don't know the name of my disease. All I see is like itching, chronic itch. That's all that caught my attention was the chronic itch. I signed up, they did a biopsy, and they were able to tell me what I have, which is PN. I think like 2 weeks after that, we started the medication. Everything's been going good. I was starting to see that some of the nodules were actually like flattening. So at this point, I'm like, Stella is getting her groove back.
I just love these clinical trials. I think it is a foundation for these rare conditions. And I think without pharma support, without these clinical trials, I think a lot of disease states would be ignored. Vitiligo, atopic dermatitis, and of course, Prurigo nodularis.
Some misconceptions. Oh, it's chicken pox. Oh, it's bed bugs. And, assume, oh my God, peeing is contagious. It's not contagious at all. I was in a store and her mother seen my skin and she pulled her child closer to her. I'm human. How do you think that makes me feel? Like you're treating me like I'm a monster over something I have no control over. We're not choosing to be diagnosed with these certain things, so just be kind.
Because I see a lot of prurigo nodularis patients in my practice, I often have to spend a considerable amount of time debunking myths for the patient. Prurigo nodularis is not contagious. This is not scabies. This is not some kind of infection that other people are going to get. The other thing that I do upon clinical examination is that I touch their nodules. I cannot tell you how many times patients have cried because they've been, how many times a day, how many times a year, throughout their life, they felt like they were contagious, that they had bed bugs, they had all these other diagnoses, and all they had was an autoimmune condition called prurigo nodularis. And prurigo nodularis is not just dry skin. I don't know how many times patients have been told just to put Vaseline or Lubriderm or some kind of moisturizer as if it's going to cure this condition. Prurigo nodularis is a complex dysregulation of our peripheral nerves and our immune system. Clinicians, our communities, we can do a much better job in coming together and really educating the public about this condition.
One thing I wish doctors would know about prurigo nodularis is that believe us when we say we're in pain. Believe us when we say it's impossible to stop itching. It is life-changing. It hurts. Okay, there are some fabrics you can't even put on because it hurts so bad. There's certain type of clothes I couldn't wear. I remember I had to start buying silk, things with silk, because if anything caught on to an open nodule, it will burn. Do not let the disease take over you. Don't let nothing take control over your life. And to remember, it does get better. I used to scratch my skin with knives. And here I am wearing short sleeves. I still have the bumps, but once again, it makes me. There's so much light at the end of the tunnel. You are not peeing.
Once you confirm the diagnosis of prurigo nodularis and you hand that script or give the treatment modality for that patient, that's just one part of the solution. The second part is to make sure that patient is their own advocate. Patients need to understand that there are support groups, great organizations like Now Included. In fact, what I do in my clinic is probably once or twice a year, whether it's psoriasis, vitiligo, atopic dermatitis, and now prurigo nodularis, I invite patients, we get on a Zoom call, and we share our stories, and they share their experiences. And I think it's just a great way to connect and really make patients understand that they are not alone in this journey with prurigo nodularis. Managing prurigo nodularis can be very difficult. I think the first step is finding a provider that understands this complex disease and a provider that understands the different treatment modalities. But what can a patient do? Well, the first thing a patient can do is maintain a healthy skin barrier. And I advise my patients to use a product called GladSkin. It's over the counter. It's not very expensive. This cream, this product basically maintains a healthy skin barrier environment so that you prevent prurigo nodularis flare-ups. Another thing that patient can do is look at their dietary intake. The less greasy foods, the less fried foods, the less sugar that a person with this inflammatory condition can intake, the better it is for the disease state overall. And lastly, we've talked about this repeatedly, is the mental health aspect of this condition. I highly encourage patients to seek professional help, join a support group, talk to friends or family that understand this disease, or it could be as simple as downloading a meditation app, trying to engage in meditation 5 to 10 minutes a day that can help a person's mental health status. Daricha's story reminds us of how every person's voice really does count. If you or someone you know is living with prurigo nodularis or any other chronic inflammatory skin disorder, I urge you to reach out, seek support, and know that you're not alone. You can join a great organization like Now Included. You may find the community that you've been really looking for. And if any of you patients that have prurigo nodularis or any other skin disorder, if you're not happy with your provider, please visit me at Heights Dermatology. My doors are open. I'd be honored and privileged to see you. Thank you, Daricha, for your honesty and courage. Your story is a true testament to the power of resilience and community. And for those of you who are watching, remember, you are more than just your condition. Let's all advocate for better care and understanding.